This episode of GT the Podcast is supported by Alcon.
This is Ike Ahmed.
And I'm Arsham Shaybani.
And we want to welcome you to GT the Podcast.
We're bringing this to you together with BMC and Glaucoma Today,
to offer audible insights into current topics in glaucoma care.
Presented by the authors of our latest, most read GT articles.
Check it out.
Welcome to GT the Podcast. In this episode, Richie Kahn, a regular Glaucoma Today contributor, recaps his article, Patients on Reddit, which is featured in the March-April issue of GT. Richie is a rare ophthalmic disease patient and co-founder and principal of Canary Advisors. In this article, Richie discusses the usefulness of the forum-style social media platform Reddit for allowing patients to connect, share stories, and ask questions. While the platform facilitates connection and support, the credibility of the information shared may be lacking. Here's more from Richie.
The internet has been connecting patients around the world since the early days of dial-up and chat rooms. Although functionality varies from platform to platform, patients today use social networking tools to share their stories, seek advice, and ask healthcare-related questions. For nearly 20 years, Reddit, a forum-style social network, has allowed anonymous users to follow and participate in subreddits, threads that focus on specific topics, ranging from soccer to vision loss and all points in between. Users can create and interact with original content, show their approval or disapproval, and promote popular posts, otherwise known as content with the most positive interactions. Due to the anonymous nature of the platform, many users feel comfortable using Reddit to ask questions about their eye health, and do so on numerous subreddits related to ophthalmology, glaucoma, and vision loss. I personally am a member of the vision loss community known as r/blind. On this and other vision-focused subreddits, individuals with a range of ophthalmic conditions use the platform to do the following: connect with other patients, seek information about their disease, share their experiences, ask for advice, and express their concerns. Recently, I spent some time on the glaucoma subreddit to learn more about what's on the minds of self-identified patients with glaucoma. Some post titles include the following: I really need some wisdom, some advice. 23-year-old woman with very advanced congenital glaucoma. Glaucoma specialist or surgeon in Minneapolis-St. Paul area. Should I be concerned? On 1,500 milligrams a day of Diamox at the moment, looking for others' experiences. Irritation due to Cosopt or tafloprost. Do you ever worry about potential long-term side effects with your eye drops? I was lazy with my drops. Now I've lost more. The Eye Triage subreddit is designed for patients seeking advice from eye care professionals. On the opposite end of the spectrum, the ophthalmology subreddit is intended to serve as a forum for eye care professionals to converse with other eye care professionals. Posters looking to ask questions about their own ocular health are referred to the Eye Triage subreddit. The anonymity of Reddit may lower patients' inhibitions and facilitate more constructive dialogue about their medical conditions, but the accuracy of the medical information shared is less clear. A recent study showed that roughly 2/3 of the posts in the cosmetic surgery subreddit demonstrated a misunderstanding of pathophysiology. Almost 1/3 of posts included medically inaccurate information. Although Reddit sometimes functions as a useful resource, patients may benefit from their physicians helping them to identify reputable sources for trustworthy and accurate information about their condition, such as the National Institutes of Health and the Centers for Disease Control and Prevention. For patients looking to become more discerning about information on the internet, UCSF Health has produced an excellent guide. When reviewing health information, the organization suggests patients consider the following questions. What is the source and is it trustworthy? Who is the author and what are their credentials? Has the publication been peer-reviewed? Who is the publisher? How accurate is the information? Is the content supported by scientific studies, reliable data, or expert opinion? If the information provided is not the original source, is the original source listed and reliable? When was the information published and how recently was the source updated? Are there red flags? Is there no discernible author? Is the author trying to sell something? Is the information based on opinion and not facts? Are the writing and grammar poor? Social media platforms provide a powerful means for patients to connect, share tips, and voice their concerns, which is especially useful for those with rare and ultra-rare conditions. Still, the credibility of medical information provided leaves much to be desired. Physicians should consider asking their patients about any sites they use to access additional information and direct them to reputable sources as needed.
While Reddit may allow for open dialogue about medical conditions, the information shared is not always accurate. As mentioned by Richie, a recent study published in Ophthalmic Plastic and Reconstructive Surgery evaluated the medical accuracy of content discussed on two active Reddit forums, plastic surgery and cosmetic surgery. The analysis included content from the top posts from 2008 to 2022. The medical accuracy of the discussions was determined by practicing board-certified, fellowship-trained oculoplastic surgeons. The most common topics of discussion included inquiring for advice on a procedure, sharing before and after photos, providing support, encouragement, or sympathy for a patient, and cost of a procedure. Study results showed that 68% of discussions included a misunderstanding of the medical pathophysiology of the patient's condition, and 31% of all analyzed statements included medically inaccurate information. The study concluded that social media forums like Reddit are best used as a source of psychosocial and psychological support and not as a primary source of medical information. Since the publication of this article, a new forum for patients with glaucoma has emerged on Reddit. The subreddit Ask Glaucoma was created this April to serve as a community for glaucoma researchers, clinicians, patients, and family members. According to the About section, this new subreddit focuses on how lifestyle factors affect glaucoma, is driven by data, and advocates strongly for patients' self-optometry. At the time of this recording, the community has more than 400 members. Thank you for tuning in to this episode of GT the Podcast. If you have any feedback or topic suggestions, find us on Instagram, LinkedIn, Facebook, or Twitter. And stay tuned for more hot topics in glaucoma care on GT the Podcast.